With regard to breast augmentation, it's a very, very common operation. It's very common in our practice. We see a wide variety of women with a wide variety of concerns, and you want to respond individually and uniquely to each of those concerns. Generically, I find it's a far better operation to put the implant under the pectoralis muscle. It has less chance of injuring nipple sensation, has less chance of hardening, it looks and feels more natural, and probably most importantly of all, you have much better breast cancer surveillance with mammography, much better visualization of the breast. With breast augmentation, in addition to implant placement, there's also a variety of locations that you can place the incision, and that is an individualized decision. You meet with the patient, you look at their anatomy, you discuss their concerns, you weigh the pros and cons, and you decide on the right approach for each patient. Now we really have to spend a lot of time with patients reviewing saline versus silicone implants, and they each have their pros and cons. I don't think it's a black and white decision. It's not an upgrade issue. It's not a one that's always better than the other. They have certain pros and cons. Silicone implants certainly feel softer. That's very relevant in the patient with thin skin and not a lot of breast tissue. That's less relevant in a patient with thicker skin and a more substantial amount of breast tissue, and that has to be weighed against the slightly larger incision that's required and the slightly more intensive follow-up. So each patient has to get that information so they can make good decisions.